All right. Good afternoon, everyone. I know there are people that are still joining, but we have limited time and a lot of information to convey. And as the folks join, if they miss a little bit of my intro, not nearly as impactful as if they miss any of the great information that the team's going to share this afternoon around childcare and all of the exciting activities and opportunities that exist there. By way of introduction, my name is Michael Wisehart. I'm the director of the Department of Economic Security, and really excited about this moment in time around childcare. I think you all are aware, working in the industry, the challenges that we've faced over the last couple of years, and even all the challenges that predated the pandemic leading into that time. I think we've seen the federal government and state leadership step into the space of making sure that there are additional resources to address some of these issues. So Arizona has received about $1 billion over the next handful of years to invest in early childhood development and education. And I'm really excited about this group of individuals on this call, the group of individuals that are collaborating in our communities, and especially the leadership of our state individuals that are really driving the change that's going to be necessary as we move this conversation away from the historic conversation about babysitting or childcare, and really start thinking about what it means to develop children early on in their lives for a successful engagement in education, and then a positive future beyond that. So huge opportunity in this space, such an impactful and important time for us to be thinking through those investments that are going to be most relevant and salient for our communities, for families and their stability, for the development of children, helping folks make sure that they remain employed, that they have a safe, stable place to take their children, making sure that we reduce wherever possible the incidences of child abuse and neglect, and really just such a long litany of opportunity that I'll get out of the way and let the individuals that are going to provide the meat of the information and are so invested in our communities in driving the changes that are necessary for the improvement in this system. But this afternoon, we've got two wonderful and amazing women to provide an update on where we are with the childcare system, with childcare investments. The first is our Assistant Director for the Division of Childcare here at the Department of Economic Security. Her name is Lela, Wendell, has an extensive resume in early childhood development, child welfare, childcare. The second is Stacy Reinstein, our deputy in childcare here in Arizona at DES, and another individual who has dedicated her entire life to the well-being of children and families. Both of them are Flinn-Brown fellows and wonderful people. So without further ado, Lela and Stacy, if you can take it from here.
Thank you, Director, and thank you everyone who is joining us today. We will also be hearing today from Monica Brinkerhoff with the United Way of Tucson and Southern Arizona, and Karla Houghtalin with our partners at Southwest Human Development. Lela and I are going to kick it off with some level setting on the infrastructure of childcare, and please know that the Q&A is open for you. So again, thank you, Director Wisehart. Thank you to Flynn. We're so excited to be here today. And not just as Flinn-Brown fellows, but as Arizonans and partners in the childcare network. So if you have been trying to find childcare or know someone who has, you know how challenging it can be. And with COVID, it's been made even more challenging for families, for children, for childcare professionals, for childcare directors, childcare owners, for employers, for our collective mental health, well, you get the idea. It's rough right now, but there is hope. Today, we will be sprinkling in a bit of reality and a lot of optimism. We hope to hear your innovative ideas, and today we are calling you in to be a part of the solution. Next slide. So at the core, we know there are certain fundamentals to building a vibrant community. This includes places and neighborhoods where people can live, learn, work, play, connect, and have access to services and support, no matter life circumstances. Each one of us can see ourselves as a leaf on this tree or connected to the tree in order to live in a healthy community. Our time here today together is a real opportunity to consider for children, for families, for caregivers, for our communities. How healthy are our roots? Are we blooming? Like I said, we have a lot of hope and optimism in Arizona when it comes to childcare, early childhood health, education, well-being. There are communities, philanthropy, and others stepping up every day. So many of you are on this call. We can and should give ourselves a pat on the back. And we can do better. What's important to remember is that this takes a community coming together with families and childcare providers to strengthen the network, lean in, and strengthen each other. We hope you're in because we're all in this together. Next slide.
So how are Arizona's roots? In 2019, Arizona partnered with the Bipartisan Policy Center to really analyze this question and quantify what is the supply of childcare and what is the potential need. The analysis was really critical in us understanding this question because as childcare exists within the state, as in many states in the nation, it's a very bifurcated system with portions of it tracked and regulated in different areas of state agencies or even in community level organizations. So in 2019, we pulled this together and here's a summary of what we found. So a minimum wage worker in Arizona spends 44% of their earnings on childcare on average. So that's assuming minimum wage of $12.80 an hour, annual salary of about $27,000 a year, and knowing that infant care can cost about $1,000 a month. So it's $12,000 a year. And that's if it's just one infant. We also know that looking at the workforce and those families that have children ages 0 to 5, there is a potential need of childcare within the state, just over 300,000. And at the time in 2019, when we analyzed the childcare gap using the best data that we had, we estimated that about 25% of that is still a potential need. And I think the most important part of this, and again, this is 2019 and is even more significant now, is that inaction, not solving this issue is an economic impact that accumulates. And over long term, over a 10-year period, it amounts to a $3+ billion loss. Next slide, please. And so in understanding this data a little more, it's also really important to understand the parents in the labor force. So in Arizona in 2019, there were over 600,000 Arizona families in the labor force with children ages birth to 5. And in this pie chart, we have the slices of pie in orange, the shades of orange, that are families where all or some parents are in the labor force, but they're not in poverty. And then the 2 blue slices of pie show those where there are either all parents in the labor force or some parents in the labor force in poverty. And that's 22% of our families. And so when looking at that information, it is important to understand, well, how many of those families are accessing financial assistance that's available for childcare? And we know that with DES childcare assistance, that's only 22,000 families. Of course, there are programs that are offered at the community level through our Head Start partners and our FTF partners that do fill some of that gap, but there's definitely area to understand if those families that need financial assistance in order to find high quality, safe childcare, are we connecting with them? Another thing that isn't shown in this pie chart is that DES accepts referrals for childcare from the Department of Child Safety. So we have about just under 10,000 children with either an open case in DCS or are in the state's custody that need childcare. And what we're seeing as an impact that isn't in this analysis is that the lack of childcare available in communities makes it impossible for children to be placed in foster families. If they can't find childcare, then how can they take kids in and still maintain their employment? So I think it's also really important to talk about in Arizona's structure, that piece of the pie that isn't even shown here. I think another thing to consider, given the last couple of years, is perhaps these slices have changed. And maybe there are families where parents had to make decisions of one to step out of the workforce in order to stay home with the children because childcare may not be available or it may not be affordable. So that is certainly another piece of the analysis that's absolutely critical in meeting our parents' needs. Next slide, please.
Thank you, Lela. So for this group, many of you already know that we live in an incredible time, that some of us, when we were children, did not have access to the widespread research of the importance of early childhood and brain development. We know that the early years, birth through elementary school, is when children begin to develop the skills they'll need for future success in school, in life. They're learning language and literacy, problem solving, focus, getting along with others. But what's been left out is childcare providers. There has not been widespread recognition or attention of the importance of the childcare workforce and providers, seeing them as professionals, as an industry and key economic driver. Until, as Lela just mentioned, COVID. Lack of access to childcare options, quality and affordable childcare, it's creating significant barriers for working parents, for employers, for foster parents, and for children's education and well-being. So what you have on this slide is the types of childcare that are available in Arizona. And also, let's talk about the factors families must consider when choosing a provider. For some families, that's cost, including those who are receiving childcare assistance from the Department of Economic Security. Families have to choose a provider that's licensed with the Department of Health Services and contracted with DES to provide and accept that DES childcare assistance. Or they can receive childcare from a DES certified family childcare home or non-certified relative provider. For those family providers that can be reimbursed for the child's childcare assistance. But the question becomes, is there an opening for the right provider in the right area, for the right hours, for the right age, who can address my child's special needs? So back to that gap that Lela touched on. What we're seeing here in Arizona is a declining or at best stagnant childcare capacity, pre-pandemic to today. Availability in childcare centers, the large centers you may see driving down streets in urban neighborhoods, has stayed about the same, while availability in the smaller family group homes and family childcare options has declined. Next slide.
And really, to look at this, it's important to understand the diversity across the state. And so here we have the childcare gaps that are estimated based on county. And so what we see here is Of course, the highest number of slots needed are in Maricopa County with just over 37,000 childcare slots needed. But when you look at the percentage, you see Graham County at a 72% childcare gap, which sure is only 1,200 slots, but it's really important to understand what is the existing infrastructure in our communities to support solutions and childcare options for families. So really, this helps ground us to understand that our recommendations really must consider how much and what type of childcare communities will actually use. And definitely the impacts of the pandemic may also change some of these preferences as well. And so this is just a starting place for us to be able to reach out to you, those of you on this call in your communities, being able to dial in and say, what can I do to help Greenlee County get 38 more childcare slots available? Is that thinking about, my neighbor who's great with kids and we can connect them to become a certified family childcare provider with DES? Is it our faith-based community that has rooms available that care for kids during service, and we could work to transition those spots to full-time childcare available? That could meet a 38 childcare slot deficit. In Maricopa County, what do we do to partner with employers, with builders, with those in our community that have maybe more capital and options to think of larger investments in childcare centers? So it really is a combination and not a one-size-fits-all. Next slide, please.
So looking at what has happened over the last couple of years that Lela and I just talked about and touched on with the gap, it is important, and we are incredibly grateful that Congress has sought to stabilize the childcare industry. It comes in to states who were already in a pretty scarcity mindset type of place, but we have had an influx of $1.2 billion into Arizona for the Child Care and Development Fund. So just a little bit of policy wonkiness. In DES, we serve as the lead agency for the Federal Child Care and Development Block Grant. And in 2014, that block grant was reauthorized to allow those Child Care and Development Fund dollars to be focused on access to quality childcare and a key focus on child development and well-being. So we accomplished that through our state and community coordination, the child care eligibility assistance, as well as our Department of Health Services, who licenses many of the child care providers, the DES provider registration agreements, our certified family providers, and a number of programs in what's called a quality set aside. So a lot of this federal funding is able to be used on several of those initiatives. And we are able to really have focused attention on stabilizing and strengthening the capacity of childcare providers to serve children and families. We've initiated programs to ensure care for essential workers, increased access to quality childcare. We've expanded key supports for children experiencing child maltreatment. But this is not just a state-owned solution. And we're so excited today to turn the mic over to two of our partners who have worked on unique community solutions, starting with Pima County and Monica Brinkerhoff, again from the United Way of Tucson and Southern Arizona.
Thank you, Stacy. I'm so honored today to have some time to talk about our unique community solution here in Pima County. Really, it was a dream that came to a reality. Here at the United Way of Tucson and Southern Arizona, we believe that we can only accomplish the kind of society we all desire and deserve when we're united and we come together. And similarly, Lela and Stacy mentioned earlier that it takes an entire community to come together to tackle the complex problem of the childcare gap. It takes leadership, takes connections, courage, and collaboration. And really, it takes a collective approach. That means that everyone needs to care and everyone is willing to do their part to be part of the solution. So in Pima County, the recent Pima County Preschool Scholarships Program is our solution. Next slide, please. So in July 2021, the county began implementing the PEEPS program, or the Pima County Preschool Scholarships. This was our local community level solution. We knew that the childcare gap existed, and we also knew that we couldn't meet the entire need. So we prioritized 3 to 5 year olds from households who made 200% of the federal poverty level or below. We chose that number because it would assist the families who couldn't afford high quality childcare, but also were above the income eligibility limits that DES had. So we were really trying to look for that gap of unserved children. So I wanted to show this graph first because it helps us track our progress toward our shared goal. And I want to note here that the role that the United Way plays is a support and a partner in the Pima County program. Pima County provides the funding for the PEEPS scholarships. They implement the PEEPS scholarships program, and we are a partner, and we step up to help out with whatever is needed here at United Way. So one of the things we helped with is to create this graphic, and it shows that we have the baseline in June 2021, and then the next little jump from that original number is the 4,440 number of children served after the first quarter. And essentially, we're trying to reach the top of the graph. We did come up with these numbers using a few assumptions for the data based on other communities' implementation of preschool scholarships. So, I think, again, maybe just noting on the left that this shows the various forms of financial assistance that come into the community for the children of greatest need. All right, next slide. So I wanted to just talk about a few details about the program. So as I mentioned, it's county funding. They directed the staff, the Board of Supervisors directed county staff to allocate $10 million per year for a multi-year commitment over a period of at least 3 years. So we're looking at about $30 million in the next 3 years for preschool slots. We're estimating that this will serve about 1,200 children a year. And it's only, in addition to the county funding, we have $1 million from the city of Tucson, contributions from other cities and towns in Pima County, contributions and support from the business community, including the Chambers of Commerce, the Southern Arizona Leadership Council, local healthcare providers such as El Rio, Tucson Medical Center, Carondelet. And I would be remiss if I didn't mention that the business community was also very critical in our efforts in public awareness and advocacy. And finally, it's not listed here, but the local newspaper was a very critical partner in making sure that the importance and the need for high quality early education and care was front and center in the media attention and in the public eye. We designed the program to use existing systems. So families and providers that we talked to asked us to keep it simple. They already have multiple reporting mechanisms that they have to use and many different funding streams. And they really asked us not to create a brand new scholarship system, but to try to use existing mechanisms that were in place. We also wanted to be sure that the funding reached all types of programs. So if you think earlier back to the slide that Stacy showed with the different childcare options, there are many childcare options. And the key point to remember is that this is an individual choice. Families need to choose the option that's the best fit for their family. And that's, as Stacy said, not a one-size-fits-all model. So we wanted to be sure that the funding could reach as many different options as we could, with a focus on providers that were regulated. So we have, there are direct contracts with school districts to open new classrooms. There's some funding going to our local Head Start grantees so that they can offer an extended time of the day. So rather than offering a half day, they're offering more of a school-based schedule. And then we are sending some of the funding through the Quality First scholarship system, which is an existing system in the state. We also had a focus on high quality. You probably heard me say that already. And we did use the DES definition of high quality for this program. Okay, next slide, please. So this local solution evolved over the past 7 years, and really it built on an existing foundation of collaboration and shared vision. So I want to go back about 20 years to 1999, and United Way of Tucson and its partners created the first Focus on Kids Coalition with just a handful of partners at that time. And as is the case with many sectors, you know, back then early childhood was kind of fragmented and siloed, and the partners wanted to come together to begin to work on solutions collectively. So now over the past 20 years, we've been building relationships. We've, as a group, mobilized around advocacy efforts. We've established shared goals together, and we've raised awareness in the business community about the importance of early childhood. And this coalition still meets today. We have over 80 partners, and we are currently, you know, taking on some sort of fun initiatives such as writing thank you notes to early childhood educators in the community and hosting an early childhood educator hiring fair. So some of those innovative things that we can only do when we come together and use our best thinking as a group. And then, you know, we also, in the past 10 to 15 years, we have even more critical partners that have come into the space that help bring our early childhood goals forward. So of course, First Things First is a critical partner, and they, you know, came on the scene back in 2009. The Cradle to Career Network, so United Way convenes this collective impact initiative as part of the Strive Together network to create solutions to inequities across the Cradle to Career pipeline. It's a nonprofit countywide initiative working to lift up community voices to make changes so that everyone can be successful in school and work. And then finally, the Preschool Promise is an advocacy group who worked tirelessly for years to advocate for the policies needed to meet our shared goals. So I think it goes without saying, but you probably heard that relationships are probably the most important key element of our success. Data was also important. We needed data to be able to inform the strategy. We had to identify the gaps and the resources that would be needed to fill those gaps. And now we need data to ensure that we're making the intended impacts and tracking any unintended consequences. So getting data from state partners like DES and First Things First still remains a critically important to our success and our work together. And finally, we just really had to be patient and persistent. So, you know, the efforts that really began in 1999 when partners came together, the actual advocacy was probably about 7 years. It started with a ballot initiative that was not successful, and then advocates had to regroup and you know, adopt a new approach. They had to bring new partners on board, and that was the time when they really engaged the business community in the advocacy under the leadership of the Preschool Promise and all of the partners that were part of that. So it's definitely been a long haul, and we're super excited that it's finally a reality. Next slide, please. So I wanted to talk a little bit about program outcomes. So the data that we have as of January, so it is a little behind, but after about 6 months of being implemented, we've served about 51% of the projected children to be served. I feel particularly excited about that because we've had significant challenges due to COVID. The challenges are staffing, reduced group sizes, staffing, increased cost to provide care, staffing. So it really isn't a thing to joke about, but staffing is probably one of the biggest concerns at this time in the field. We're also working collaborative with partners right now to try to address the shortage of educators and see if we can come up with some potential solutions to attract and retain early educators into the field. So if you look at the little bottom left-hand corner, we did have an innovative aspect to our community solution. We tried to remain aware of potential challenges. And going into this, we knew that the high quality capacity in the community that would be able to absorb the scholarship dollars was limited. So it really wasn't just about getting more money into the system, it was about building the capacity and making sure that the seats were available. So with that in mind, United Way created a pilot project or a pilot program specifically designed to increase the number of high quality seats in Pima County as quickly as possible. So the program does two things. It expands existing high quality. So if there's a provider that can open a new school or, open a new classroom, we're available to help with that. And we also can help prepare programs that are newly entering into the Quality First system to get a quality rating on their first try. So really, I think of that as like a pre-SAT course, if you will. And so we designed this, again, intentionally to try to supplement and complement what the Pima County preschool scholarships were bringing to the community. So I just wanted to offer a few things to consider if you are thinking about maybe doing this in your own community. Just thinking about stakeholders. Who is it? How would they be impacted? What is their interest in the initiative and the effort? And are their voices heard? What's the gap between the current reality and your goals? And that's where data comes in as a very useful tool. What are the resources you need? So I give an example of, we initially had just sort of a general estimate of high quality is about $10,000 per child. And I'd say maybe, 2 or 3 years ago, a lot of us were using that figure, even though we knew that wasn't the true cost of quality. And now as more research is being done and we're really looking at all the costs that are involved with high quality, we're now thinking it's maybe closer to 14,000 and up. So really thinking through what are the financial resources that you might need in your community. Just remembering to learn from what you do, tracking your successes, your challenges, keeping in mind unintended consequences of your efforts, and then just being sure that there's intentional outreach to the communities that might be impacted by the program. So I wanted to also mention that we have many other communities in Arizona who are working towards similar initiatives. So, of course, Tucson is not the only one, and who also have been successful, including Tempe, Flagstaff, Mesa, Phoenix, and Yuma. And all these communities are at some point in either investigating or having had success in getting some funding for preschool. We have a learning community called the Arizona Pre-K Alignment Team, and we come together, we share ideas and resources and stay connected. This group came together as a result of our participation in a project with the National League of Cities. And the connection to each other and to other communities across the nation has been really helpful. We can ask questions and learn from each other, and it's just been really great. So if you're interested in joining us, if you're not one of the communities that I just named and you think you'd like to start a similar effort, please don't hesitate to reach out and we can connect you to our group. So finally, I just wanted to say that our successes in Pima County inspire me personally, and I hope that they provided you something to think about for the communities where you live and work. Next, I'm going to turn it over to Karla, and she can tell us a little bit about a statewide solution to the challenges that face childcare providers.
Thank you, Monica, and thank you all for joining us today. So as a third-generation Arizonan, just like you, I'm passionate about system changes in my community that improve outcomes for children and families. So on a personal note, thank you for being here and caring about children and families. At Southwest Human Development, we are passionate about quality care and education for children, and we understand that we have a role and responsibility to assist the early care and education industry, not only to provide quality, affordable childcare, but to help it be sustainable. So just like the early care and education system for families can be difficult to navigate and understand, it can also be difficult for our providers. And we saw a need to support those providers. So in 2019, our early childhood business management program began. We heard from small business owners and providers that there was a need for support and training around business management skills. So we have made it a goal to provide individualized coaching and training in business management to owners and directors throughout Arizona. To date, we have successfully served 100 programs with a goal to put through a total of 550 in the next 2 years. Our work centers around intentional business management strategies for system changes in the early care and education field. So we work with statewide partners like DES and United Way of Tucson, who are also engaged in this important and the timeliness of this work. They understand it. So we've created a standard curriculum of business skills and practices that we use, but what makes this process special and unique is the individualized nature of the work. So our participants have multiple opportunities to work with professionals, business professionals each month. Once a month, they have an opportunity to come together in groups and meet with business professionals in our community to learn about topics like accounting, payroll, marketing, labor laws, billing and collection, using automation, providing and paying benefits to staff, and so much more. And then they receive at least 2 additional touch points a month for one-on-one support by a business management specialist. And that specialist works with them to reinforce those business skills they're learning. They set goals together, they build budgets, they read financial reports, and then they learn to understand the data and financial reporting so that they can do things like apply for grants and other funding and use that automation. So moving providers to a child care management system is another really important part of our work, because what it does is it helps them manage their business, reduce costs, and save on that administrative time. The administrative time that can be put with teachers and families and children. So while we understand that many organizations provide technical assistance in business, we understand that that is out there. But we think we're unique because we are focused completely in this industry, in the early care and education industry. So we understand what businesses need, and we understand what early care and education leaders need. And so we believe that providing those touch points, those monthly meetings, our early care and education owners receive something that they have never done and never had before. That's access to business professionals in their community. They are learning education. I would love to just share a quick story with you. This past month, we had a meeting where an HR director came and spoke with them and to talk to them about some labor laws and something like things like sick time and vacation time and the laws around that. And afterwards, we heard from a provider who went back and said in business 15 years, didn't realize it was a law to offer sick time to employees. And so now we have 20 people in the early care and education field who are now receiving sick time because the owner and the director were educated in those laws. So again, the first time having access to these business professionals. And this work is important because in Arizona, we have dedicated early care and education providers who are trained to provide phenomenal quality education and care to our children, but they didn't go to school for business. They don't have a business acumen. They haven't built that business knowledge or confidence to run a business. And they're overworked and overwhelmed. And we've heard that in this presentation today, some of the barriers. So we help them set aside that dedicated time to work in their business so that doesn't feel like so much, that they have a partner in this, helping them build strong businesses. And so our team provides that support to overcome those barriers, build capacity, and help them become strong business leaders. And so we have some outcomes in our program. We want to increase their revenue, right? Because we want them to reinvest that into quality. We want to help them understand that cost of care Monica was talking about. And so that they know, what does this cost to care for this child in my program compared to what I'm earning? And we want to help them set goals for profitability, because we want them to put those profits and reinvest it back into the quality care of their program. We want them to be proficient in automation, because we have seen providers, we don't want them to just have a childcare system, right? We want them to be proficient, because we've seen them go from having thousands of dollars in past due balances down to zero. And as the state becomes more innovative and moves forward with technology, we want to help those providers, and we are working with them, to be comfortable with technology so that they're ready to meet the state's technology requirements. And they have a partner walking with them hand in hand to get them there. Because we do still in Arizona have providers managing with pen and paper. So this capacity building, this readiness is very important. We also need them to have access and understanding of their business health, and that's through that data. So we help them collect their business data, read their business data, so then they can make sustainable business data-driven decisions. If there are changes that need to happen in their business, they now have the information to make those decisions to stay sustainable, to stay in business. We want staff retained. We want to keep quality staff in the early care and education field. So we coach to leadership skills. We help them understand comparable wages in this industry, how to raise those wages when they can, how to recruit staff, and then how to retain those staff, how to provide health care benefits and other benefits in their program to entice new staff to this industry and to keep staff. Because what we want is what I know all of you want, and that's sustainable, strong early care and education programs that stay in business, increase access spots, childcare spots for Arizona families, and that's ultimately important. So as we build our program and the demand continues to increase for these business skills, we are here to ask our business community to partner with us. So those of you here who would love to partner, because just like Monica said, and what we've all said, and really the most important thing about this partnership with the four of us is no longer being siloed and working together to solve this industry's, the struggles that we have. And really that's the hope, is that when we come together, we are building capacity and providers, and we're giving them access to you. So we're asking our business community to partner with us, to reach out, to help us provide those additional connections for our participants. Because as we work to stabilize childcare here in Arizona, all of our Arizona businesses benefit. So thank you.
So we hope something sparked for you today to inspire you to connect with us, share your ideas on how you or those in your community can give us some additional perspective of the gaps in your communities and how we might be able to address those in a collaborative partnership way, a way where we can invest this incredible investment in ECE so wisely to show the benefits that it can have immediately and really set our youngest ones up for success in the future. We did receive several questions in the question and answer section, and we did respond to some of those. And if please, share other questions that you might have. We do have a little bit of time here, so I think can even go into explaining a little more around some of these questions here. There's one, Karla, that I think you can help provide perspective on as well, that's in the open section of our Q&A from David Longoria with List Phoenix. So right now there's the influx of capital being invested in the state in the name of equity. Aside from whatever your opinions might be on that, how can we better organize and focus these resources and collaborate with partners to support practitioners of color who serve underrepresented communities, particularly as it relates to business and operations management? I will say one thing that is very interesting, especially around childcare, is you see a difference between the price of childcare and what it costs to provide childcare. So the price of childcare is driven by the incomes of the families in your communities. So we know this just from, business practices. If your rates for childcare are more than what the families in your community can afford, no one's going to select you. They can't afford to. But that really presents a problem where in our lower income communities, the cost of providing high quality childcare, which is another thing that maybe we can talk about a little more, that we got a question on, is significantly higher. So the cost of infant care, for instance, at the beginning of this presentation, I shared that, let's estimate that infant care is $1,000 a month. Actually, in a high quality setting, that's much, much closer to $2,000 a month because of ratios and staff qualification. So infants, you need more adult supervision to care for them, to hold them, to feed them, to change them. So, there are some things that make a lot of sense when you get into the business structure of things. But you see how, if we don't have a system that helps support childcare providers to continue to be able to provide high quality care, regardless of what their parents can afford, there's a significant inequity built in fundamentally there. And luckily with the federal regulations, we're able to address gaps like that and rethink the way that we structure reimbursement for childcare from a DES perspective. And Karla, I'd like to offer you an opportunity as well to address that question.
Stacy, did you want to say something first? Okay, I saw that you said live. And David is a great partner of Southwest. So hi, David. So what I would say from a provider perspective, so when I'm talking about our boots on the ground, first and foremost, it's a relationship building. So it is going in and finding those providers and letting them know that these opportunities exist. So something like technical assistance in business, so that there's enhanced subsidies that they could qualify for, that there are stabilization grants that they can apply for. So it is building trust that we are here for the best interest of their communities and hearing them and letting them partner with us to shape what these programs look like. The other piece is boots on the ground cannot change right now the cost of care or some of the slots that are open, but what we can do is hands-on help these providers understand their subsidy contracts. And so we go through those with them and help them understand their obligations and responsibilities. So then that also leads into, are they billing and collecting the subsidy that is owed to them? Are they billing correctly? Do they understand the process? Is there made a mistake? We're building some resilience to go in and rebill and do that correctly. And so it really is some of that hands-on approach. Is there a stabilization grant or another grant available right now that you can apply for? And let's help you do it. Sometimes even applications that we think are easy and non-competitive can still feel overwhelming and maybe not worth the effort. And so we're showing them it's worth the effort, it's easy. So I think it's a lot of that hand holding. And when I say that, I mean that in the way of support. We are walking with providers, meeting them where they are and building that trust and that relationship. Because if we have that, then they are open to more and more ideas. And so I just, from a boots on the ground, that's where I say that we start.
And I'll just add to David's question and Karla's answer is we have a whole cadre of family childcare providers. And so our team, many of whom are on this call, so I just want to acknowledge them as well, because we don't do this without them, are working hand in hand as well. Many with Spanish speaking providers, ensuring just the basics, moving from being the nana to a childcare provider is very different. But we trust that they have the heart and passion to be the childcare provider. So how do we, again, meet the needs that we have in order to ensure we are continuing to receive our federal dollars from the Office of Child Care while also supporting the providers where they are. And then another acknowledgement, we do have some of our community college partners on this call. They are another inroads for us to help support the business practices, the basic health and safety training, many other needs that we don't often think about, but our community colleges are in our communities. So they play a huge role in supporting our childcare providers in that space. Oh, and I see Don actually just asked a similar question. So we are really just starting to delve into that in our expanded partnership with Southwest Human Development and our work with the community college collaborators. Who else in their schools, like their business teams, can be there to help and support childcare providers. I know we've had that conversation with Northland Pioneer up in tiny little town. Those are opportunities that Southwest Human Development is providing to other partners who are the boots on the ground to do that helping hand and that reach out. So that is definitely not just on our radar, but in our orbit right now. Lela, did you want to go into a little more detail on one of Dax's questions? I thought they were really insightful.
Yeah, I feel like I touched on it a little bit. We can certainly go back. We have been able to partner with our First Things First agency and produce a draft cost of quality study. And so we learned a lot that answers those questions in detail. And it's really no surprise that the largest cost is staffing. And like we mentioned, depending on the age of the children, there's different ratios of supervision from a state minimum standard, but those ratios are even smaller when it comes to high quality care. And so we typically see that being the largest difference between the cost of kind of the minimum standard care to the high quality care. There's also some additional compensation for staff with bachelor's or master's degrees, which is certainly something that we promote in professional development. But unfortunately, the compensation is still pretty low. Just yesterday, I was in Tucson with Monica and her team that put together an awesome ECE workforce hiring fair. And, just talking with some providers there, I mean, they're looking at bringing in lead teachers at $15, $16 an hour and assistant teachers at minimum wage. And, they're a little stressed out about meeting that increase of the minimum wage requirement. And the reality is these staff, as much as their hearts and passions are with children and early childhood development and learning and growing these beautiful brains, there's also the reality of wages being higher in retail, restaurant, other areas. So, it's really trying to not how do we assist covering that cost of care? And I think that's a larger question than just a DES and partners question. Thinking about how our employers are part of this solution. thinking about how we message and professionalize the field in general. Being able to share some of the information that we're learning about, what does it really cost to provide high quality care for an infant? $2,277 a month for a 5-star infant care setting. That should be equitable, equal access to every community, no matter what they're able to afford. So super interesting. And even if there is some interest to learn more, Dax, we're happy to set up some time to walk through some of the specifics as well. And as Karla mentioned, we're really looking for partners in the business community to help us really be able to share these business practices. It is different in childcare. Hopefully it doesn't always have to be so different from any small business, but right now it is. So that complexity and working through it and having additional support to get that out there is very important.
So I see Terry's question. I think it's really important to note that we do have a number of philanthropic, private, other funders that are very interested in early childhood and childcare right now. And it's about leveraging the public funds, but also making a sound investment so that when the federal funds end, that we have that sustainability and partnership in place. So I know that Southwest Human Development has developed incredible public-private partnerships in order to implement several of their much of their work. What Monica spoke about in Pima County is a perfect collective impact example of that as well. And, from the state's perspective, we are always open to enacting those partnerships. And sometimes, just frankly, it's easier if it comes through one of our community partners or philanthropic agencies, and then we can leverage something unique like we have been able to do in place with Pima County. Don't know if anyone else wants to touch on that. I know we are almost at time. I am happy to stay on for an additional 5 minutes if there were any other burning questions, but I see people hopping off for their 3 p.m. meetings. Thank you, David. All right, Lela, do you want to share, or Karla, our last slide and just thank you? So again, back to our trees and our garden. We know we are all in this together, and we're just really grateful for having some new voices and ears in the room today, and for our teams back at their offices and out in the field, and mostly to our families and the childcare providers that are continuing to serve children and keep us afloat in Arizona. So thank you.